If you are a senior receiving Social Security or disability benefits, October 2025 is bringing several significant updates that could directly affect your income, healthcare, and coverage options. This month marks a turning point for millions of Americans as new regulations and policy shifts are taking effect across Social Security, Medicare, and Medicaid. Many beneficiaries are unaware that these changes are already underway, and not understanding them could lead to missed benefits or unexpected costs. The most anticipated update is the annual Social Security Cost of Living Adjustment, commonly known as COLA. This adjustment is meant to keep benefits in line with inflation, ensuring that rising prices do not erode purchasing power. The official announcement is scheduled for October 15th, though a potential government shutdown could delay it. The Bureau of Labor Statistics must release the September inflation data before the Social Security Administration can finalize the COLA increase. If the shutdown continues beyond mid-October, that report may be postponed, temporarily halting the announcement. Throughout the year, the Senior Citizens League has tracked inflation closely to forecast the COLA increase. Early in the year, predictions were as low as 2.1%, but as inflation continued to rise, estimates climbed gradually to 2.3%, then 2.5%, and by late summer to about 2.7%. Many experts, however, believe that this projection may still underestimate the real increase since many seniors continue to face higher prices for essentials like food, rent, transportation, and healthcare. These costs have risen more sharply than general inflation measures suggest, meaning the actual adjustment could be slightly higher once the final inflation report is released. If the 2.7% figure holds, the average Social Security retirement recipient would see an increase of about $54 per month. Spousal benefits would rise by roughly $26, survivor benefits by $43, and disability benefits by a similar amount. For those on fixed incomes, even these modest increases can make a difference. But when compared to the rate of inflation in key spending categories, the gains are often too small to offset rising expenses. This pattern is not new. Data shows that Social Security benefits have failed to keep pace with inflation for most of the past 15 years. Analysts attribute this to the outdated formula used to calculate the COLA. The current method relies on the Consumer Price Index for Urban Wage Earners and Clerical Workers, CPIW, which tracks the spending habits of working adults rather than retirees. Because seniors spend a larger share of their income on healthcare, housing, and food, categories that often rise faster than the overall inflation rate, the CPIW underestimates the inflation they experience. Advocates have long pushed for the use of an alternative measure called the CPIE, which focuses on the spending patterns of the elderly. This index gives greater weight to medical care and housing, better reflecting the financial pressures seniors face. If the CPIE were used instead, annual adjustments would likely be larger, helping retirees maintain their purchasing power. Studies estimate that over the past decade and a half, seniors have effectively lost about $370 in benefits each year due to this mismatch. While the COLA increase remained the most visible change, significant updates to Medicare are also unfolding. Premiums for Medicare, Part B, which covers outpatient care, are expected to rise by about 11%, while deductibles are climbing by roughly 12%. These increases outpace the expected COLA, meaning that many retirees could see much of their Social Security raise absorbed by higher medical costs. This contradiction highlights a growing problem. Even as benefits inch upward, healthcare expenses continue to rise at a much faster rate. At the same time, the Medicare landscape itself is shifting. Many insurers are scaling back or discontinuing certain Medicare Advantage plans for 2026, particularly in specific counties or rural areas. Some large carriers are exiting unprofitable regions, reducing the number of available options for beneficiaries. This means that when open enrollment begins on October 15th, many seniors will need to review their plans carefully to ensure they still have adequate coverage. Plans that worked last year may no longer be available, or their costs and benefits may have changed significantly. For those navigating Medicare's complex system, this open enrollment period will be more important than ever. Beneficiaries are encouraged to compare their current plan with others available in their state or county, paying special attention to prescription coverage, provider networks, and total out-of-pocket costs. Even a small difference in premiums or deductibles can add up over a year, and with inflation continuing to to push up costs, every dollar counts. These developments collectively underscore the challenges facing retirees in 2025. Social Security benefits are rising, but not fast enough to match inflation. Medicare costs are increasing at an even faster rate. And at the same time, the number of plan options is shrinking in many areas, leaving seniors with fewer choices and higher prices. The result is that millions of older Americans are struggling to maintain the same standard of living despite working and contributing for decades.